What this grant does is it provides for a research structure to study the long-term effects of concussions on civilians and service members. Our goal is to really understand who is at risk for difficulties after a concussion, who's at risk to get a concussion actually, who's at risk for difficulties afterwards, and how do we manage that. So that's phase one. The second part of this goal is to understand what those short and those long-term limitations will be for certain patients, understanding how we can mitigate or improve those effects, and preparing our health system in the VA and in the civilian world, as well as the patient and their family for those long-term effects. With VCU as the hub or the center of a consortium, we will be partnering with the Department of Veterans Affairs, Department of Defense, as well as university centers of excellence in brain injury care. I think it's important to put into context that there are 3.5 million concussions a year in civilians. And in the conflicts in Iraq and Afghanistan, 20% of service members were exposed to at least one concussion during their tours of duty. So this isn't something that occurs now and then. It's a large problem, and it's something that just isn't well understood. We're looking forward to a very aggressive and exciting research ride